During this time, Northside Medical, located off of Deerfoot Parkway, Trussville, communicated at some length with St. Vincent's East Hospital. Northside told me they were going to get me seen by some orthopedic doctor that they had a handle on or had access to, or some kind of communication with. I was given paperwork for financial assistance. That's not the St. Vincent's Access to Care program, but this is another type of financial assistance. Anyway, I filled that out. I fulfilled that, and I was approved for some type of financial assistance. But I later learned that it wouldn't help me in getting to see an orthopedic doctor. It would help cover bills and past expenditures with St. Vincent's East Hospital. Was told the financial assistance paperwork was to see an orthopedic doctor. Filled it out. I was accepted. Called St. Vincent's East and asked about the financial assistance and what it entailed, because they don't explain what it means. They just say you're approved for something. The people that answer the phone at the financial assistance desk, I'll go ahead and say both of them, the Access to Care and this one, not very people friendly. Nasty, evasive, deceptive, flighty, not the kind of people you want dealing with the public or with sick people in a medical setting. You need caring, compassionate people who can allay the fears and the concerns of these people. Some of them may be dying, including myself. You need friendly people that are dealing with the public, hospitals, doctors. There's your piece of advice right there. It's time for some changes. I believe I've been blacklisted in the St. Vincent's East system because I know, and I know about my injury that they lied to me about and covered it up. And I called them on it. They know that I know. It's no secret. I was told that the financial assistance was to cover the past bills with St. Vincent's Hospital. Northside Medical said I needed to apply for access to care after this. One thing that stood out to me is the phone that I was using to communicate with this place, it was turned off most of the time for privacy and security reasons. And it was something that stands out to me now. I will never forget this now in light of what I've come to realize. They had somebody in their office would call me, and they told me, hey, do you have your phone turned off? You need to keep your phone turned on. You're going to be expecting an important call. And then they told me to activate my voicemail. And this is like weird. I have never had anybody have this much concern over the use of my phone. What's significant about that is on my phone, in order to receive voicemails, you have to turn on mobile data. Okay? Taking these phones around where I live, you hear the speakers pop on them regularly, like the computers. They've got some kind of transmitters, transceivers in the area where I live, I believe, that are patching into these devices, and this is how the hacks are being done. Okay, so think picocell spoofing. If you just can't read between the lines on this, I'm poor, and mobile data on my phone, it's never turned on, ever. I don't even get calls or voicemails that are worth turning on mobile data to hear them. But if you have a phone and you keep the mobile data turned off all the time, well, if you turn it on, you've just opened up like a super highway, information-wise, like into your device, through which all kinds of exploits, code, malicious code, viruses, and all this other stuff may pass. So yeah, a very pushy overture from a group that revealed themselves as nothing but stooges for St. Vincent's East Hospital, Ascension Health. But now I've realized that I've had several phones that have been hacked in the interest of eavesdropping, I believe, on what I'm doing. And I can't help but wonder, if some of these hacking, eavesdropping efforts were began last year sometime. I've had aggressive, ongoing hacks for at least 4 months, night and day, round the clock. Who can afford this? Real simple, just ask yourself that question. There was this phone tag thing going on with voicemails on my end and on Northside Medical's end. They were trying to get me assistance with one doctor, and then that would fall through. Then they knew somebody else. They tried to get me in with some other orthopedic doctor. And every time it led nowhere. It was just a waste of time. Lots of false hope. And I wasn't feeling too good from this injury that, it was going on a year, and I still had no diagnosis and was not on a road to getting this thing fully treated. The infection had been noticed kind of like unofficially, but the broken skull, this is still undiagnosed and unacknowledged by any of these medical people that I've gone to. I would apply for access to care. I said I was denied already. I got the runaround for months from Northside Medical. When you call that place, Northside Medical, usually a human being, a person, does not answer the telephone. It goes straight to voicemail. And you might get a call back later that day, in a few days, maybe never. And that's my experience dealing with them. Some voicemails never return. Phone tag is not fun. Finally told by Northside to go to Cooper Green Hospital. And I've been denied at Cooper Green also, and I made them aware of that.